Merhaba Dambaş. Iru, we talk about the epidemiology, the basic epidemiology concept. Epidemiology history is the history of the human being, at least from the ancient Greek, from Hippocrates, Hippocrates, about more than 2,000 years ago. So began the history of the epidemiology. He was the father of the medicine book, Hippocrates in Greek. So in the ancient China, ancient Greek. So he considered the factors that or determinants that influence the occurrence of the epidemic, for example, weather. But recent centuries, the 19th centuries, is about 1,840, about 8, that a physician, a doctor in London, his name was Snow, John Snow, in 840 years of about 1,854, about 160 years ago or more, Dr. John Snow found that the risk of cholera, waba, in London was come from the water, drinking water, in a community in London. So the history back from to Hippocrates, but recent by John Snow, epidemiology. This is a translation of the recent page that I show you. So John Snow دست نشان کرد که خطر کولرا ده لندن تکلداری اخوارین آو کو اخوارین آو کو جیب چی بو یعنی کولرا was polluted by cholera, by bacteria. So by this it was the modern epidemiologist, John Snow. A successful surveillance system include to نظارت system the importance of the disease, time, representativeness, consistency, completeness, accuracy. So these factors are very, very important in epidemiology. If you want to know more, so please read the article about this in this address. So importance of the disease. Here, importance of the diseases. I describe a little more here. Does the disease have a high impact? Is a high then virulency or morbidity, for example, cause a lot of people to die of this disease, to be die, mortality, to be morbidity, to be sick. For example, influenza, AIDS, HIV virus that cause AIDS, food poisoning, measles, a viral disease. All these so cause morbidity and mortality. Does have a significant epidemic potential. For example, cholera, AIDS, SARS, COVID-19, coronavirus, for example, 19. This is have significant epidemic potential. It's very, very aggressive. Is there significant public health action being taken? So, what can we do for these? Can we do vaccination? For example, polio disease, poliomyelitis, measles, whooping cough. Whooping cough is the Farsi siyah sorfe, the coughing, the rush coffee, because oxygen cannot pass to the lungs enough to the circulation, so they cause the kind of oxygen deficiency, as I mentioned before. What can we do for this? Timelines. Timeline or timeliness is very important for the nazarat, for surveillance. So, what can we do is very, very, we must, without losing time, to be prepared, to prevent, to fight against the disease. What factors, so if needs to be taken? So, these are the important measures. Representativeness means at the people that we are, for example, that we take for to study, or represent all the community or not. So it is very important that the group of people represent all of the peoples in the community. Otherwise, our result is not correct. So, from an epidemic, so we must collect the data, AMAR, analyze so the statistic, information, اطلاعات and report. So, we collect the information, analyze it, تحلیل, and then interpretation, and then response. What can we do after that? For example, so we collect the information about coronavirus that is in community. We study the situation of the patients, the people, the area, among the children, among the olds, among women, men, which part of the country is more affected, and then we interpret it, tafsir. We interpret it and then we take the measures. For example, give the medicine and every challenge that we must do to stop the disease. So this is called the elements of surveillance system. How can you detect asymptomatic infections. So an infection can be symptomatic or asymptomatic. A is negative, means that there is no symptom. So some diseases have no very clear or high symptom. So we can take by laboratories we can find the disease. Otherwise, you cannot find the disease exactly. What is the origin of the disease? What is the feature of the disease? For example, we must take the blood to find that it is hepatitis B, C, D, or hepatitis or HIV/D or something else, or coronavirus. We can take the feces to find the polio or salmonella or shigella or amoeba, or so this is maybe the infection be asymptomatic. So, or can be symptomatic. We find a symptom. So for example, fever. When there is fever, there is headache, there is some other symptoms that we say, okay, this is the kind be coronavirus. Then we can find by the PCR machine or by other thing to find the disease. So this is some examples of the surveillance. نظارت چند مثال. Acute poliomyelitis, for example. Poliomyelitis is a kind of the فلج أطفال infection that paralyze the muscle in body. So this is asymptomatic. So in children, or there are other for example, a toxin produced streptococci. Streptococci is a kind of bacteria that cause a toxin in tonsils here, so and can cause the mortality of among children or heart disease. This is a kind of, if I show you this, figure number 4.1. So scarlet fever. Scarlet fever is a infection of bacteria that name of bacteria is Streptococcus group A. This Streptococcus produce a toxin, some in blood, and cause the scarlet fever, a fever that the skin becoming to be red. So if you see here, you have here the for example, this means 20,000, 40,000, 60,000 of the people. Here, the number of the people, patients. The patients number, here is the year, 936. So if you see from the beginning, more than 100 of people in England and Wales. So this is follow-up of the scarlet fever between 1936 to 2000. So you have 2000, 20 years ago, and this is the beginning of the study from here. In these years, scarlet fever was high. Here, the most very high level, about 120,000 of the people got the disease of scarlet fever. Then decrease here. Then again in this year, 52. Here the after World War II, and then down, but we have a rise here. We have epidemic here again in this year. So, but you see here in this year, 1980, less than 20,000, very low people. So it is decreasing. Every time it's decreasing, coming down, down, down. 2000, we have now so much scarlet fever, maybe 100 or few. So this is an epidemic study that show so we can here analyze the result of the study. Why this scarlet fever is coming, under these years is coming to be less and disappear. So this is information very useful to find the cause for the coronavirus. Now it's very high, coronavirus. Hope to one day it comes to be disappear like this. So what happened here? So because of the hygiene, because of maybe the good treatment, the information about the disease. So this is an epidemiologic study that followed up the situation of this streptococcal infection. So this graph showed that scarlet fever in England and Wales from these years, 70 years, under 70 years, or 64 years. So this showed this. From the beginning, more than 100,000 so infection patient from the 1936 here. About 100,000. And then a small increase a little between 41 to 40. A little increase here. 120,000 suddenly in this year. 1944. Then decrease. So this trend has been generally downward, decreasing about 60 years, reaching very small number in 2000. Reaching very small in 2000. So this is the feedback of this graph. So I may give you some graph and ask you to interpret it, to explain it, to analyze it. For example, like this. Here we have another graph. So I ask you please to interpret this graph. What happened here? We have the years 1913 to 1990, about 80 years. Follow up. This is year, this is the peoples that got the disease of some diseases. Tuberculosis, cell. This shows the death, the people died, Merene. more than 30,000 or 35,000, and this year disappears. And here vaccination. Here vaccination BCG, Bacillus guanin, the vaccination, and this is X-ray that use the vaccination, use the chemotherapy, kimyavi, درمان kimyavi, for example. Here, this curve showed that here, suddenly the death and the use of this is coming down. So it means that exactly the same graphs has disappeared. That's very, very low in 1990. So outbreak. What is outbreak? What is outbreak? So it is very important. Outbreak means suddenly a disease, epidemic appear in the community. شیوع. So this is, for example, coronavirus outbreak in December last year in the community, in the world. Outbreak, suddenly coming a disease, appearing of a disease, attack of the disease, attack of the of some diseases, for example, maybe infectious disease or something else. It's important for investigation, the outbreaks. Now we have the pandemic of the coronavirus outbreak. So, our duty as epidemiologists is to find the cause of the outbreak, cause of the epidemic. The cause of the epidemic, which is important. So, by what? Diagnosis. To find the information, collect the information, and then analyze it. Which time began the disease? Which place? Which person? Exposure. Exposure means to be exposed to some disease, to some agents, to be near to attack. For example, if we go to the street without mask, and we talk with the people and, for example, do not do the social distance, فاصله 2 متر. For example, go and shake hand and very close. So we are exposed, we are open to the disease, to the infection. So this is not good. So we must find it which group of the people exposed to the disease. For example, doctors, nurses, makhbar staffs, the people that working with the hospital, they are exposed to the diseases, very open. Those that work with the patient, those that working with crowd, for example. So these are exposed. Here we must interpret yani tahlil, analyze, and to think about. So we have all information here in the community. We have the information from laboratory results, from doctors, clinically. We are everything we have in here as a report. So these reports, so we must categorize it, classify, and then to interpret it. What can we do? What is the problem? What can we do by this? What is it? Is a new disease like coronavirus is new? Or is a old one like cholera that's old? Cholera have been in the in community in the world many thousand years ago from till now. But coronavirus is a kind of mutation of the virus, influenza virus. So this is important to find exactly what is the agent of the disease, what is the determinants of the disease, which group of the people is exposed, which group of people are very sensitive to this disease. So what can we do it? Is better to have a vaccine? Is better to give this malaria, for example, medicine, or we have no any medicine? If we give this medicine of the HIV, so may kill the patient. So what's good? Coronavirus, for example, 19, have no any exact vaccine now. Have no any medicine. درمانش نینه. تازه جدیده. نوه. چه بکیم؟ So you must find the best preventive. پاراستن، باشترین پاراستن چیه؟ دست شستنه. Gel, alcohol, for example, mask, and have a distance, 2 meter distance, social distance, فاصله جیواکی, and to have a good equipment in hospitals, respiration and everything that we prepare for those that are very sensitive. For example, those that have diabetes, those that diabetes, شکر خونشه, those that have for example, asthma, سیگار جرگ سپی چیه حساسه. So these group of people are exposed to the disease. It's very sensitive. So it is important to have the... So then we come to the case definition. So for the next time, hope to see you. Have a nice time and ساق و سلامت و تندرست و شاد و خوشحال بین حوال.